Hello. Today I am bringing another topic for my subscribers. Thank you very much for supporting me. And once again today, as per your request, I am bringing a new topic. The topic is tinnitus, that is ringing in ears. So what exactly is tinnitus or ringing in ears? This is a sound, continuous sound, which is being heard in the ear though there is no sound source in the outside. That means the sound is inside the patient's head or in the ear. So there are two types of sounds. One is subjective, that is the patient hears, but whatever hearing mechanism you put, say stethoscope or any, if you go near the patient or put a stethoscope on the patient's ear, you cannot hear it. Means the sound is very much heard by the patient, but you cannot hear it. This is called subjective. Patient hears. Another one is called objective. The patient usually hears like a bruise sound, say something of the flowing or say throbbing or pulsatile sound, which you put your stethoscope in the ear or around the ear, you may hear it. This may be because of some say blood vessel abnormalities or any other problem around the ear, which is pathological and easily not related with hearing. So most of the time, tinnitus or ringing in the ear is related to hearing problems. So what are the common causes? The most common causes are, say, age related. For example, hearing problem because of increase in age, or maybe exposure to noise or acoustic trauma, or maybe exposure to certain drugs which are injurious to the ear. Then also it can be because of heart problems, then some tumors in around the ear, or when the thyroid hormone is increased, or say any blood vessel abnormalities or any blockage of the blood circulation in the ear. So many causes are there, but it is most common in the old age group, and sometimes about 15 to 20% of the old age people, especially more in case of the men than women. So about 1 crore persons in India. India's population is about 120 to 30 crores. Out of that, about 1 crore people are having tinnitus at any point of time. So that much common it is. Okay. So now the causes I already told you. Now what are the symptoms? How you feel it? It is feeling like a, say, buzzing sound, like a honeybee buzzing sound, or some roaring sound, roaring of the engine, or say some clicking sound, or maybe some hissing sound, just like in the pressure cooker, like that hissing sound. Then, or in a kettle when you are boiling water, like that. Then it may be some humming sound. So sometimes patient also cannot exactly say what type of sound he or she is hearing, but he hears a sound. Okay, so that is very disturbing to the patient. So these are the symptoms. Then what happens is that most important thing is the patient gets too much, anxious about the sound which is being heard. One anxiety is that it is disturbing with the patient's daily, activities, or say when the patient is especially in a very quiet surrounding, when he is lying quiet, the sound comes and it disturbs the sleep. It becomes very depressing, sometimes stressful to the patient. So these are the complications. Mainly it may disturb the sleep. It may produce, anxiety, depression to the patient. So these are the, and even sometimes fear of a very serious problem in the ear. Okay. So these are the patient's complication to the patient. Now how to treat a patient with tinnitus? Patient coming to you will complain about the tinnitus. Then you have to find out what are the possible causes of the tinnitus. Because if you treat the cause, the treatment of tinnitus will be complete. So first of all, you have to see generalized examination of the patient, any defect in the ear or surrounding here. And another thing is about the blood test, whether the patient is having increased thyroid hormone, or say patient is having any blood increase in the blood sugar, or whether there is any earlier disease like syphilis or anything. So VDRL tests are to be done. At the same time, if there is any defect in around the ear, then you have to do MRI or CT scan. Then basic thing is patient coming with tinnitus, with always having some hearing problems, so you have to test hearing. So testing of the hearing usually best done in a two-chamber, where the patient is sitting in one chamber and the examiner is sitting in the other chamber. And this is the ideal way of testing, and it should be completely soundproof room. So no sound should come from outside. If there is no sound only, then you can detect exactly how much is the intensity of the ringing inside the ear and what sort of ringing it is. This can be matched. We call it tinnitus matching. We give certain sound to the patient, and we try him to compare with the sound which he is hearing, and after some time, if it is coinciding to the sound that we are giving, after some time at certain intensity, the sound inside the patient's head will be lost. So it is it. That's how we can detect the tinnitus, then what is the frequency of the tinnitus, and at what level it is. Sometimes it is very difficult to detect. Okay, so that is the hearing test. Then we need the MRI to find out, or CT scan to find out any structural changes around the patient's ear. So these are the tests that we usually do. Regarding treatment, coming to the treatment, treating a tinnitus is very unsatisfying, because sometimes the reason behind this is that sometimes the real tinnitus frequency and intensity may not be met properly. Another thing is patient is having some psychological psychological superimposition on what he is having. So, and as you see, if there is a hearing defect and this hearing defect cannot be corrected, so naturally the tinnitus will continue. But sometimes if you give proper hearing to the patient by giving some hearing aids, and in the hearing aid there are also some mechanisms to suppress the tinnitus, then it will be a very good way of treating a patient. Now, if the patient is not having too much of a hearing loss, but you have corrected the hearing loss with the hearing aids, but still the patient is hearing, in those cases you may have to do give certain treatment. Say for example, sound therapy or tinnitus retraining, where you may have to give some music, or patient is given certain musics or some sound generators. Even a little noisy fan also may remove the tinnitus, and the patient's intense attention is being drawn to that sound. So this is one way of treating it. Another one is transcranial magnetic stimulation. There in certain advanced centers, transcranial magnetic stimulations are being done, and there are certain equipments which are being produced and being given to the patients, and some of them are quite effective. So sometimes if the patient is not improving or not getting any relief from any of our treatments, sometimes patient has to live along with it. Then sometimes I used to tell to my patients, suppose there is one engine running in your neighborhood. You cannot do anything about that. You cannot tell the person who is running the engine to stop, or you cannot use any legislation or legal mechanism to stop that. Then sometimes if you are not moving away from that location, then you have to get adjusted with that. That is one way I usually tell my patients. Now sometimes because of the theoretical theoretical basis behind tinnitus which is being produced, it is like this. Our ear is just just like a microphone. It is the area where the sound goes in. This is the mechanism of going inside of the sound, taking up the sound. But sound is being processed, and the hearing is usually done by our brain. Brain is for perception. So naturally, when there is hearing loss, brain tries to listen to the sound, but sound is not coming from the ear. That leads to certain sound being produced inside the brain, and this sound which is being produced inside the brain it is not in the ear, it is inside the brain. So sometimes you don't know in which ear you are hearing this, whether left or right, or it is inside the head only. Sometimes patient will tell. I usually draw a simile or certain situation example to a patient. It's like this: if you are tuning to a radio, transistor radio, and suddenly when the signal stops coming from the transmitter area, so you will hear a static sound like that. Like that. Okay, so why is it? Because the radio is trying to catch the sound, and the signal is not being received, so certain static sound is being produced. Some mechanism more or less similar to this is happening inside the brain also. Your brain is being very active, trying to perceive the sound, but the sound is not coming, so naturally there is another sound being produced. So this is another theory for tinnitus, like that. So first of all, treatment of the tinnitus has to be done very compassionately, and you have to listen to the patient's complaints, and we should be understanding whether you are a family member of the patient or family spouse also. You have to be very much understanding to the patient. Patient is really having some stress, some anxiety, and you should not add up to the anxiety, you should try to reduce it. So be good to them, listen to them, and try to find out a solution. Okay, this is how there is not much of a role of a surgery or any operation, because unless it is some structure which is being defective, you cannot do any surgery. Okay, so I have shown in the previous pictures also the hair cells inside the cochlea, or this where the sound is being received. The hair cells may be damaged, then only you have hearing loss, and this also leads to tinnitus. Okay, so for the treatment of tinnitus, it is not very easy thing. We have to sit with the patient, we have to get confidence of the patient, and sometimes if we treat it effectively, that's good. Otherwise, we have to tell the patient to get adjusted with that. That is the last resort. But mind you, out of all the tinnitus, majority of tinnitus are treatable, so don't be worried. And if you are having some patient near you, or even yourself, if you are suffering from that, please do consult an ENT doctor and get your tinnitus be treated as soon as possible. Thank you very much for today. This much. Okay, bye bye.